Welcome to SpaMedicaTV TV. My name is Dr. Stephen Mulholland here in Toronto. Good to see you again. Today's show, soft tissue fillers. Soft tissue fillers. What are soft tissue fillers? These are substances we as physicians can inject under your skin to either fill up space, soft tissue gels like Restylane, Perlane, Juvederm, Teosil, other soft tissue sugar gels like that, or they're stimulants like Radius, Sculptra, and we inject them under the skin. They stimulate your own collagen production. Regardless, as skilled aesthetic physicians, we're able to use a soft tissue filler to bring back the fullness of youth, because as we age, air comes out of the face, deflates like air out of a balloon. You lose that fullness of youth. We can use soft tissue fillers to help restore that. Let's take a look at one person's experience with these soft tissue fillers in achieving a rested, youthful look.
From NBC News, this is Today with Matt Lauer and Natalie Morales, live from Rockefeller Plaza.
Health news. Do you want to look younger without having to bother with surgery? We're going to show you one woman who's going to give the 30-minute facelift a shot this morning. No cutting at all, which is good for me. I won't pass out. And we're going to follow along live.
Good thing I'm doing the interview
in
as
just
well.
a little while.
This morning on Today's Consumer, a non-surgical facelift in a flash. Does it sound too good to be true? Well, if you're scared to go under the knife, but you want to look younger, it just might be the answer for you. In a moment, we're going to get one started, and you'll be able to see the results for yourself in just 30 minutes. Today's consumer correspondent Janice Lieberman is in Toronto, Canada, where the procedure originated. Good morning, Janice.
Good morning, Natalie. Forget the scalpel, forget the long recovery. The Volumalift promises similar results for a short term, but that's a great selling point for some.
You look at TV and you compare yourself. And even women my age and older, they look wonderful.
52-year-old Virginia Cawthorn is tired of what she calls her haggard look.
I really don't like the lines that I've got, and I think it's from the sun. I don't like the lines above my lips, under my eyes. It just ages you, and I just like a little bit more youthful look, that's all. I've had a rough 2 years. You know, I've gone through separation, and that takes a lot. It takes a lot out of you. I was surprised how emotionally draining that was and how that affects your appearance.
As a result, Virginia says she's extra self-conscious.
If I have a date, I make sure we're in a really dark corner, and if they say, "Can I see you tomorrow?" Oh, no, I don't think so. So, you know, that's not good.
After a heart-to-heart talk with a girlfriend, Virginia decided to look into the Volumalift, the latest in non-surgical facelifts.
My girlfriend said to me, "You know, you show all the pain that you've ever had in your life on your face." And, you know, nice comment. She goes, I don't mean to be mean, but you do. And she says, your face, you know, you need, you know, maybe some fillers. And I thought, you know what, maybe I'll give it a shot.
Virginia finds this procedure appealing because there's no cutting involved, just injections of a facial filler.
It's not major surgery. It's just sort of pumping it up a little bit so I don't look as sunken in.
Once it's done, what's she looking most forward to?
I'd like to feel good about myself when I go out. Not maybe worry about that date in the darkness.
Ready for love. Oh, baby, I'm ready for love.
So we're here with Dr. Stephen Mulholland in Toronto, Canada. He's ready to start the Volumalift. We're going to start our clock now. Doctor, tell us what you're doing to Virginia.
We're adding a little bit of Restylane to the sunken and deflated areas of a face that inevitably occur as we age, and that volume will give a three-dimensional fullness that replicates many of the effects of an open facelift.
Because a lot of times people look stressed or they look hollow here and it looks phony and it doesn't look good. So this really counteracts that by putting the volume back.
It restores the volume that we lose with age, and so you're exactly right. Rather than lifting, many people benefit from the addition of volume. And so I'm adding Restylane, which is the most commonly injected soft tissue filler in the United States right now, in the areas that Virginia has lost with age. And this will produce a very pleasing and startling attractive look very early and very quickly after the procedure.
And Dr. Mulholland, Natalie Morales here. How long will the Restylane last? And is she feeling any pain right now?
I put a little bit of a local anesthesia or freezing in, so she doesn't have much pain. When you use Restylane in lines, it lasts about 3 to 4 months. I'm injecting down along the bone, and when you do that with this Volumalift, it lasts about 8 to 12 months, so a nice year-long pleasing improvement.
And we're going to check back with you all in 30 minutes from now, and we'll be back right after your local news.
And coming up in this half hour, you're going to have more on this thing that we've been talking about, this 30-minute facelift.
The Volumalift, and it's taking place right now in Toronto, Canada, and Virginia is our patient there. As you see, Dr. Mulholland is injecting a little Restylane. I hope you're not a little queasy of the stomach, but it's going to be, we're going to show you the live results in a couple of minutes, and it's basically an instant facelift by adding this filler to your face, so taking away a couple of years.
That's going to leave a mark.
I'm telling you, I feel
Now,
like
apparently the recovery is pretty quick, as you'll see, and not that much bruising. And you're looking live at Toronto, where 21 minutes after it all began, our facelift in a flash. It's just wrapped up there, as you can see, and our consumer correspondent Janice Lieberman was there for the whole thing. And Janice, let's go back to you. How did it all go?
This is a big wow, I got to tell you, Natalie. We're sitting here for 20 minutes, as you said. Look at her face now. She has not seen her face. Virginia, first, how do you feel?
I feel fine. A little swollen, but good.
All right, now you ready for the big reveal?
Oh, wow.
Doctor, how long will this last?
The Volumalift lasts about 8 to 12 months in the areas that we brought back the volume she lost with age.
Now, if she loves this, can you do something more permanent the same way?
Absolutely. So most patients try on the temporary version that lasts almost a year, and then they can go into a longer-term injectable.
And Janice, maybe we can show, maybe we can put up the pictures and show Virginia before and take a look at her now as we see her. And doctor, I mean, clearly this is not a long-term solution. You say it's going to last anywhere from 3 to 8 months. Who is an ideal candidate for the Volumalift?
Well, Volumalift is about 8 to 12 months, and ideal candidates are those people that look in the mirror and they feel they've lost that volume of use. So they're sunken under the eyes, through the cheeks, around the mouth and the jawline, and above the eyes. So it doesn't lift the loose skin on the side of your face. It brings back that central volume that so many aging people have.
But sometimes you need a combination of a little bit of lift and a little Botox. It's not all one package deal.
Yeah, combination therapy is great too, but volume is often one of the most essential missing ingredients in a youthful face.
Virginia, how do you feel about the results?
Oh, I think it looks great. I'm just a little frozen. I'm self-conscious the way my lips are moving.
Yeah, well, you look great. I mean, I'm telling you, you look fantastic.
I know. I can't believe it.
And doctor,
who can have this done? You do. It's done in Canada, but you also can have this done in the States?
Yeah, there's over 400 doctors I've trained personally, and they can be found on the www.volumalift.com website. The price for this procedure is about $2,500, which is pretty good value for almost a year of lift. And then usually it's about double that for the permanent filler.
Virginia, do you think this is going to be it for you, or are you thinking perhaps a more long-term going the full facelift route next time around?
I'll see. Yeah, I might do that. This was very painless, really.
All right.
What's her recovery going to be like?
And will there be any bruising?
She'll be in makeup tomorrow. Yeah, there's a little bit of bruising now in certain entry points of the very small needle, but most people look good in makeup the next day, and they can blame it all on their dentist. They can say, I had some dental work, and everyone will believe them.
So she can go to work tomorrow with no worries then? Blame the dentist.
Well, she doesn't have to worry if she blame it on her dentist. Always blame it on your dentist.
All right. Virginia Cawthorn.
I like this, no cutting.
You're a brave woman. We appreciate you doing this for us live on national television. Thank you so much.
My pleasure.
Dr. Stephen Mulholland and Janice Lieberman, great job. Thank you once again.
Thursday, July 20th, 2006.
From NBC News, this is Today with Matt Lauer and Natalie Morales.
On Wednesday, we showed you the woman, Virginia Cawthorn, getting a 30-minute non-surgical facelift. Well, how does she look a day later? She's going to be here to show us, and we thought that was important because, to be quite frank,
she was a little swollen yesterday.
And not all that able to talk after the procedure, and I'm sure a lot of people watched that and said, well, that didn't look too good. Anyway, we're going to find out how she is.
She looked good, but she just really couldn't talk very well.
A little uncomfortable. Anyway, we'll check in with her. All right. Remember on Wednesday, we introduced you to a woman. Her name was Virginia Cawthorn, and she was agreeing, we're going to walk here, she was agreeing to undergo what was called a 30-minute facelift, a Volumalift. No cutting involved, actually just a bunch of injections. Well,
with Restylane.
We checked in with her about 30 minutes after that procedure, and although she was happy with the way she looked, she was a little, I guess, a little sore and maybe in a little bit of pain, and it was difficult for her to talk. So we decided that we would like to see how she's doing 24 hours later. And if we dissolve to the studio now, welcome Virginia back. Hey, Virginia, how are you?
Hi. Well, I'm certainly a lot better than that clip I just saw.
You know, you were the subject of conversation around the office yesterday because we did talk after the show and say, okay, she looked better, but she also looked like she was a little uncomfortable with the way she was feeling. How much pain were you in?
You know, it's funny. The worst part was probably the freezing, when they put all the needles in for freezing, and there was needle. And once that was in, it was fine. I wasn't in any pain when they were actually doing the injections.
You're just a little numb then, so you kind of had trouble talking.
Well, my lips, they felt like liver. I was sitting there with these big lips. In my mind, they were out like...
You felt like Goldie Hawn.
A platypus, you know? Platypus lips, no.
So here we are 24 hours later, and you've spent some time in front of the mirror this morning. How do you like it?
You know, if you see the shots before and the shots now, there is definitely a difference. I had an awful lot of lines. I did. I had a lot of lines.
And we're taking a look at those pictures right now. And meanwhile, you do seem, you have a couple spots of bruising.
I have bruises, and it's still a little swollen.
But that's expected
and
to go away
this happened just yesterday morning. So I mean, it's amazing that you get a younger look in such a short time period.
And what was the reaction at home?
Well, I have my 17-year-old son. What kind of reaction you're going to get? Nothing positive
great,
there.
Mom,
But I had a girl from phone. She says, "Oh, especially around the eyes." She says, "You really look good around the eyes."
Well, there's the eyes right there, before and after, and I have to say it's a dramatic difference. I think we have a before and after picture of the area around your mouth as well, and let's take a look at that. And while there are still a few lines on your upper lip, there's no question that some of the lines are less noticeable.
Oh, yes, you can definitely see that.
Now, this is something I think I remember that your kids really didn't want you to go through one of the more traditional facelifts because of the permanency of it.
Right.
And so you like this whole idea because it was kind of test driving a facelift. It basically lasts for, what, 8 months?
8 months, right.
So is there kind of a clock ticking in your mind this morning that, okay, this looks great, but it's going to be moving away?
Yeah. I'm sort of looking forward to maybe 3 months from now when it softens a little bit. I'm sure that's going to be the best. And then I'm going to be watching and counting down until maybe I'll have to do something else.
And this is a doctor based in Toronto that does this, but he is teaching doctors across the U.S. and it does cost $2,500, though. I should point out the cost of that.
And I was going to say, and I know a lot of people didn't know you were doing this yesterday until they saw you on TV.
I'm sure I'll get a few phone calls.
Yes.
I didn't tell my mother.
You have now. Virginia, thanks very much.
It was my pleasure, really.
Good to have you.
All sorts of guests today on the show, so please welcome Dr. Stephen Mulholland, who's joining us today. Before we actually talk, Steve, well, let's take a look at this new procedure that he performed on Lena. Take a look.
Lena,
Hi.
good to see you again. It's been a month now, and I thought it was time to get together because I've been very happy with your progress.
Great.
Juvederm is a natural soft tissue gel. It's a filler. Rather than relaxing muscles like Botox, we're actually bringing soft tissue out. Who's a candidate? Someone who's lost the fullness of youth, does not want surgery, an alternative surgery, wants a simple way to bring back full cheeks, fill out their smile lines or fine lines or wrinkles. It's really an injectable soft tissue lift. You've been very happy with the outcome
Extremely happy.
of this Juvederm makeover.
Extremely happy.
Okay, well, let's take a look. I thought it'd be a good exercise to just see where we've come from. When I first met with you, you said you looked gaunt. You felt you looked tired, deflated, that you looked, older than your age. And if you look at, you were hollow under the eyes. You had a sort of a gaunt look, but very nice facial features. If you look at the after, the Juvederm Voluma has really brought back what I would call the fullness of youth.
a makeover.
It is amazing stuff.
She literally went, she's already an attractive woman, but she turned into a supermodel. Like, it's amazing. So you say Juvederm is a filler. Talk to me a little bit about how it works.
It's a sugar gel, so it comes in a consistency of soft gel. And like the last segment, you know, when we get into our 40s, 50s, we tend to lose the air out of the balloon deflates. It brings back that volume. And many women, everyone wants to look their best, but many don't want surgery. And as we've talked about many times in your show, we can look 5, 6, 7, 8 years younger without ever pulling out a scalpel with a lot of these non-surgical makeovers.
So non-surgical, so there are like no cuts, nothing at all. What do you actually do then?
Well, like with Lena, what we did was sort of like an Allergan eye makeover. A little Latisse, which brings out your lashes 40% longer, 40% thicker. Some volume, like the Juvederm, little Botox to relax the muscles. Some of the new fractional lasers to bring that firmness back to your skin, and you look 8 years younger in 60 minutes, plus a few days recovery.
Okay, so what's the recovery about? If there's no cutting happening, what's happening to your face?
I still warn people that if you're going to do this type of thing, that's why I do my non-surgical injection days on a Friday. So you take Friday, Saturday, Sunday off. Tell people I've been out golfing, working in the garden, look a little pink. And, you know, by the middle of that week, though, you're looking pretty darn good in makeup. And by the end of the week, you look good without makeup.
Okay, so does it hurt at all? I know that it's not surgical, but does it hurt?
Yeah, there's always a little bit of, I don't call it pain, but aesthetically acceptable discomfort. Pain is very random.
We're about to go into an election. You need to be a politician. You need to run. That was like perfect. Okay, so not pain.
There's discomfort, meaning that we use some freezing. So it's like going to the dentist for some random cavity you can't even see. This time we freeze you, and once you're frozen, everything's done quite comfortably. And so there's the pain of freezing, of the local anesthesia. After that, you're good.
Now, is it like Botox in the sense that you pay by the injection?
It depends on the physician's office. Some are by the injection, the syringe. I generally just do a global look. We're going to throw everything at you that you need, that genetics and hereditary and photo aging and life took away from you at this price. And so I tend to globalize rather than, you know, piecemeal, because when you piecemeal, patients only usually buy the belt and forget the pants. But they don't look great without the pants.
So they get the whole package, and then they come out looking great. So we should tell everyone, though, you don't always get to go to Mark Anthony's salon and get your hair done as well.
That
was
special surprise.
Right? That was very special. So what would you call the efficacy rate? Like
100%.
100%, and people love it.
Well, again, it's about understanding the expectations, what they want to achieve. It's not going to get you a new job, save a failing marriage, or you know, get you off antidepressants. It's going to help you feel as good as you want to look. And that's really what we do, and the rest is up to the person and their new face.
Any side effects that you need to watch out for?
As always with medicine, there's side effects. Surgery has some potential big risks. Non-surgical like these makeovers, bruising, swelling, slight asymmetry, all falling in that fixable category.
Okay, beautiful. Well, not only did you show us that gorgeous makeover, you've also brought something for the whole audience. So thanks to Steve and SpaMedica, everyone is going to take home an optimal eye and lip makeup removal kit. Awesome. So this dissolves makeup. It leaves the sensitive skin around your eyes and your lips feeling re-energized and hydrated.
Amazing what we can do without a scalpel now. And I'm a plastic surgeon. I do a lot of facelifts, but I'm still amazed what we can do with soft tissue fillers, be it Sculptra, Radius, Restylane, Perlane, Juvederm, Teosil, Astellas. There's many options out there. Come into SpaMedica, find out what's best for you. I'm looking forward to seeing you so we can achieve the kind of restful, useful rejuvenation that you're looking for.